Welcome to this Communication Skills and Ethics station for the MRCP Paces examination. I'm just going to read out the scenario for you. For this scenario, you get 14 minutes with the patient, a minute to collect your thoughts, and then 5 minutes with the examiner. And the patient and scenario for today: you've been called to the emergency department to see a patient who is 12 weeks pregnant and she's 20 years old herself. 2 weeks ago, she has had a long, uninterrupted car journey, and 2 days ago, she has had an episode of shortness of breath, which again happened today. She has been reading a pregnancy magazine and has been concerned about clots on her lungs. Her oxygen saturations are 91%, but the rest of the examination and a chest X-ray are normal. Current guidelines suggest that if the clinical probability of a PE is high, you organize a Doppler ultrasound of the legs first, and once you exclude a DVT, you consider either a VQ scan or a CTPA to confirm or exclude the diagnosis of a PE. She is currently only on folic acid supplementation. Your task is to explain what can be done to establish the diagnosis and what treatment is appropriate. Hello.
Hi.
My name is Dr. Punika. Is that Dr. Agarwal?
Yes, that's me.
So this is station 4, Communication Skills and Ethics for the MRCP Paces examination.
Right.
You have read the scenario outside.
Yep.
You get 14 minutes with the patient, a minute to collect your thoughts,
Okay.
and then 5 minutes with the examiner.
Okay.
I'm going to give you a warning when 2 minutes are left with the patient.
Okay.
Okay, would you like to proceed?
Okay. Hi, is it Lauren?
It is, yeah.
Hi, my name's Sunil Agarwal. I'm one of the doctors that's
Hiya.
just come down here just to have a chat with you to see what we can do to help you.
Okay.
What's your last name, sorry?
Bradley.
Right. Is it okay if I call you Lauren?
Yeah, that's absolutely.
And can you just confirm your date of birth for me?
Yeah, it's 15th of the 6th, 98.
Right. So that makes you 20 years old, does it?
Yeah.
Okay. So this is the first time I've met you. So are you able to give me a bit of a talk to me about what's brought you in here and if you have any particular concerns or worries at all?
This morning I was just walking. I'd been at the supermarket and I was
Right.
walking, and I got really short of breath, really
Right.
quickly. Yeah, it's just a bit scary, really.
Okay. And did that just happen today, or have you been feeling out of breath over the past few days at all?
It happened, I'd probably say about 2 or 3 days ago, something like that.
Okay.
Sort of similar, really short of breath, quite.
Right. And any other symptoms, like any pain in your chest or any cough at all, or anything?
No.
And I was told by I was having a look at your notes before, and that you're pregnant. Is that right?
Yeah.
How many weeks pregnant are you?
12.
12 weeks. Okay. And has there any been concerns at all with the pregnancy up to
No,
now?
it's been going really well.
Right. Okay. And other than the shortness of breath, any other symptoms you've noticed?
No, not that.
Nothing like any swelling in your legs at all, or
No,
anything?
they
like-
get a bit sore at the end of the day if I've been doing
Right.
a lot of walking around. But
Right. Okay. And have you been any long distance journey at all recently, or have you?
we went down to see family in Somerset a few weeks ago.
Okay.
The car ride back from there was quite a long time.
How long was the car ride about?
We didn't really stop, so I'd probably say about 6 or 7 hours, something like that.
And do you take any medications or anything?
No, I'm just on the folic acid at the minute.
The folic acid. Okay. So you said over the past few days you've been getting a bit more out of breath, and you're 12 weeks pregnant at the moment.
Yeah.
You're taking folic acid, and you also mentioned there's this long distance journey that you had. Is there anything else you think I've missed in terms of your symptoms or any other?
No. Another reason why I was quite frightened this morning, just before it happened, I was actually reading. I'm subscribed to this pregnancy magazine, and I
Right,
was
okay.
flicking through that, probably about 20 minutes or so before it happened, I was flicking through that and I was reading about sometimes like shortness of breath and like gasping can be caused by like clots and things
Okay.
like that.
Okay. So that's something you think that you've read about and you think it could
It's
be.
made me panic a little bit.
Right. And we'll talk a bit about that afterwards, but other than that, do you have any other concerns or any specific questions you have?
No.
Okay. What I'd like to do now is just have a bit of a chat about what I think could be causing this and about some of the investigations we might need to do and some of the treatments involved. Is that okay?
Yeah.
So, as you were saying about in pregnancy in the magazine you were reading, sometimes you can get clots in your body. Because of what happens to your body during pregnancy, it can make your blood a lot more likely to clot. So sometimes people can get things like clots in their legs or sometimes clots in their chest. And that can give them symptoms like shortness of breath if you get a clot in your chest. And don't worry, it doesn't sound very nice to have a clot in your body. However, they are relatively common things and they're very treatable as well, which we're going to talk a bit about afterwards. Also, as I said, you being pregnant, you're more at risk of that. And if people have had a long time where they've not been moving around, such as a long car journey, that can make people more at risk of these clots, which is why I think this is something we need to look into, and we probably need to do a few further tests to see if this is something like a clot in your body.
Will those tests need to be done today? Just because I've got quite a young boy at home and he's with my partner and I'm a little bit worried about him, that's all.
Okay. So the test that we do, I'll talk in a second. Now, the issue with this condition is, as I said, it's relatively common. It's something that can be treated if you do have something like a clot. However, they can sometimes be severe, and if they're not treated or investigated promptly, they can develop and can make people quite unwell. And obviously that could affect your child as well, your pregnancy, if it was to make you quite unwell. Also, your oxygen levels are quite low. Because of that, we'd need to give you oxygen to get your oxygen levels to a level that is acceptable. Okay. And also that would be beneficial to your pregnancy. So I think it would be unsafe for you to leave until we get this sorted, because if we were to delay the treatment or the investigations, that could affect you and your pregnancy as well, and not giving you oxygen as well could affect things. Does that sound reasonable, or does that sound like it's going to be a problem if you were to stay with us in hospital for the next day or so?
We could sort something out. I'm not going to die, am I?
So again, obviously, it's good that you came to us early.
Yeah.
This is something that is very treatable if it is a clot in the lung, and we can give you treatment for it, and the treatment is successful. It's usually, you obviously don't know what's going to happen in the future, but this, if it is a clot in the lung, that's a very successful, the treatment's very successful. However, the main thing is if treatment is delayed, or if the diagnosis is delayed, that could affect you and your baby. Okay. And that's obviously part of the reason why we would take this seriously. Yeah. Why we'd want to keep you in hospital to monitor you, to check for any complications or any signs that things could be getting worse. Okay.
Yeah.
Is there any other specific questions or concerns you have for me?
No, I don't think so. Just any risk that the test might have towards the baby.
So what I'd like to do now is talk a bit about the test that we do. What we would do initially is a scan of your legs. As I said, these clots in your lungs, if you do have a clot in your lung, they usually develop because you first developed a clot in your legs, in one of the veins in your legs, and that can travel to your lungs. So the first test we would do is a jelly type scan called an ultrasound of your legs to see if there is a clot there. If there is a clot, then we give you the treatment for the clot, and there's no further tests we need to do. However, if we don't discover the clot there, we then need to do tests on your lungs to see if there is a clot on your lungs. The two tests that we might need to do, one is called, they've both got fancy names. One is called a CTPA. Basically means you go into a scanner, we cover your baby so your baby's not affected by the CTPA, and you go into a scanner and they give you x-rays to see if you do have a clot in your lungs. Okay. That's one of the tests. The concern or the issue with that is that if someone's pregnant, because of the changes to a woman's breasts when they're pregnant, it can give a very, very, very small increase of breast cancer several years later on. But I emphasise that's a very, very small increased chance in the future with a CTPA. Okay, the number is about 0.7% increased risk. So it's very, 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 very small increased risk. The alternative for a CTPA is something called a VQ scan. Now a VQ scan, they give you an injection and it does various things to see if there is a clot in your lung. The downside to a VQ scan is that, again, it's a very, very, very small risk, but if you're pregnant, there can be a tiny increased risk of childhood types of cancers with a VQ scan. And as I say, that sounds very horrible, it doesn't sound very nice, but these risks, the increased risk to your baby of childhood cancers is very small with the VQ scan, or of the CTPA, the increased risk to you of breast cancer later on in life is a very, very small increased risk. I know that's a lot of information I've given you. Is there any questions you have or anything that's not made sense or anything you're concerned from what I've told you?
Other than obviously with the VQ scan, with the CTPA, there's no risk to my baby, is there at all?
No risk to the baby. They cover your baby, so they put, I don't know exactly what it is, but it's sort of a board, I think it's a lead board, they put over your tummy when they do the scan so that your baby's not affected during it. Yeah.
Okay. How do they treat it? Is the treatment different, varying, or?
So the treatment that we give with someone who's pregnant, if one of these tests does discover you have a clot, we give you injections called heparin or low molecular weight heparin, and they're these small injections that people usually give in their tummy. They're not too uncomfortable. Lots of people manage it very, very well, and you usually have them maybe once or twice in a day, and you have that throughout your pregnancy and up to 6 weeks. 6 weeks afterwards.
Okay.
Sometimes people need to continue longer, but usually it's up to 6 weeks afterwards.
Would I be able to go home with that, or do you need to be in hospital? Or?
No, so again, this is something, if you do have the clots, we would give you the treatment here, and then we can train you, or if you're not happy, some people have concerns about injections with something, we can train maybe someone who's close to you to give you the injections. But the injections that we give you, as I say, every injection has mild side effects, but it's to help the clot from progressing and obviously to have no negative effects on your baby.
Are there any other treatment options, or is that the only one?
So with pregnancy, this is the one we choose. If you weren't pregnant, we usually start patients on a medication called warfarin. I don't know if you've heard of warfarin before at all.
No.
So it's another type of medication that we give for clots. And the reason we don't give warfarin during pregnancy is because warfarin can be harmful to your baby.
Okay.
So that's why we don't give warfarin to treat clots during pregnancy. We give you these injections because they won't harm your baby. Okay. Do you have any other questions for me or anything that's not been clear at all, or any concerns from what I've said?
No, just a bit scared about the whole thing.
Yeah, and as I say, it's understandable. I've given you a lot of information about various things. I can give you some leaflets about some of the tests that we've talked about. And obviously, whilst you're here, if you have any concerns or worries, you can write them down or ask any of the nursing staff or any other doctors that you see whilst you're here. But as I say, the main thing is that what we think you may have, the clots in your lung, that's a relatively common thing. It is treatable, and we're keeping you in hospital and doing the test. We'll find out what's going on to do the best that we can for you and your developing baby.
Will the test be done today, or do you think I'll be in a couple of days? Or?
It depends on, we'll request the test, and it depends on what you choose, so you don't have to decide today about the CTPA or the VQ scan. We can give you some information about that, and depending on what you want to do, if that's needed, because we do the jelly scan first. But it's likely that you will have to wait for a few days or so until we can do the tests. There's usually there's a queue for the tests, and only people who are very, very, very unwell, as in they need it very, very urgently, will get the test first. So you will likely end up staying for a day or so in hospital.
Okay.
I'm afraid.
Which one would you recommend?
So again, I wouldn't want to, because you're your own person, I wouldn't want to tell you what to do, and you don't need to make a decision today about the test that you want to have. We can give you some information about that, about the risk to your baby of the VQ scan, and about the risk to you of the CT scan, and help you to make the decisions. With this, usually the CTPA scan, that has a very a bit better at detecting the clots than the VQ scan. So if you had the CTPA, it is slightly a bit more better at detecting a clot if there is one there than the VQ scan, because the VQ scan can very rarely sometimes miss a clot that's there. But you have to consider that the CTPA, you might not want that because of the small increased risk to yourself later in life. And again, with the VQ scan, you might not want that because of the small increased risk of childhood cancers with having that, which isn't an easy decision to make, but we can help you with that.
Thank
Okay. Any other questions for me?
No, I think that was it. Just, I'm really grateful for your reassurance.
Okay, okay. Well, we talked a lot about today, and as I say, if you have any further questions, ask us, and we'll start with the treatment and get these scans organised for you. Okay.
Thank you.
It's nice to meet you, Mom. Thank you.
Right, okay. So you've seen the patient, you've spoken to her about this suspected diagnosis of PE. Would you like to tell me what principles guided your discussion, your conversation with the patient, please?
Okay. So my discussion was mainly guided by the four main principles of core principles of medical ethics. The main one with this that was relevant was autonomy, was the patient's choice and her right to choose what investigation she had and what treatment she had. The other principle is beneficence and doing the right thing for your patients, and making sure that everything that we're doing is really in the best interests for the patient and the baby as well. And also non-maleficence is another important principle, and that goes about not doing any harm. And that can be tricky. Sometimes beneficence and non-maleficence, they can contradict one another in a situation. For example, with this, a CTPA would be beneficial, or a VQ scan would be beneficial to the mother in seeing if there was a PE, but it could harm the baby in some way. So there is a balance sometimes between beneficence and non-maleficence. And the final principle, justice, is about treating people equally, which may not be as relevant in this situation. That's another principle to keep in mind.
Okay, good. Let's just come to your first principle you mentioned, autonomy. Are there any situations you can think where you wouldn't give that autonomy to your patient?
So autonomy, the only time you wouldn't is if the patient doesn't have capacity. And if you don't believe they have capacity, there's various reasons for that, you as a doctor would have to do what is in the best interest of the patient. And that may mean involving relatives or carers or close family friends or maybe other healthcare professionals who have known the patient for a long time to try and see what is the best thing to do for that patient.
Okay. Let me just ask you a couple of questions on capacity. Can you think of the principles of how you would assess capacity?
Okay, so there are four things that number one is that you should always assume that a patient has capacity. Only when you feel they don't have capacity, then you go and assess. So you should assume that every patient you see has capacity. There are four ways in which someone needs to say they do have capacity. Number one is that they understand what you're saying and they accept that as the truth. Number two is they can retain that information. They can remember that information for a reasonable period of time.
Okay.
The
good.
third one is that they can weigh that information up to make a decision. That decision may not be what you think is appropriate, but it's that they can weigh that information up to make a balanced decision. And the fourth thing is that they communicate that decision in some way. And if they have all those four, then a patient has capacity.
Okay, can you think of any examples where a patient might lack capacity?
So one example is a patient who may have cognitive impairment, such as Alzheimer's dementia.
Okay.
Because of the Alzheimer's dementia, their short-term memory may be impaired.
Yeah.
So they may not be able to retain the information you're giving them for a long enough period of time to weigh that information up.
Okay.
So that's one example where someone may lack capacity.
Can you think of an example where they may have a lack of an ability to communicate?
So patients who have strokes, sometimes if their speech is affected or their writing is affected, sometimes it may be difficult to communicate. Yeah. In that situation, you as a healthcare professional should do everything you can to enhance how they can communicate. So there are visual aids where people can point to things, or sometimes with locked-in syndrome, people blink to try to communicate.
Yeah. Good, good. Okay. Let me just move on from your principles of assessment of capacity onto the treatment and the investigations that you were offering to the patient. You mentioned about the risk of breast cancer to the mother. How much did you say was the increased risk?
So I believe from the literature, the increased risk for breast cancer is by 0.7%, so 7 out of 1,000.
Is that the increased risk?
Yes.
Okay, okay, good. And you said you're going to treat her for the entire duration of a pregnancy, which is going to be about 7.5 months from now, possibly 7 months, and also for 6 weeks after.
Yes.
Yeah. Okay. So, for example, you decided not to give a warfarin. Can you think of a reason why we don't use warfarin
So
in
because
such patients?
warf is teratogenic, it will pass the placenta and can give fetal warfarin
Thank you.
syndrome.